So my name's Brooke. I'm going to be the nurse practitioner student that's going to be seeing you today. So I understand we're seeing you for an annual wellness exam. Is that correct?
Yes, ma'am.
Okay, so we're going to start with just an assessment of your head, eyes, ears, nose, and throat, just to start your annual wellness exam here, okay? Starting with your head, we're just going to look at symmetry. Your head appears symmetrical. There's no concerns for bony deformity or anything that I can see to the shape of your skull or facial bones. Your eyes and ears appear symmetrical. There's no drooping to either eye, to one side or the other. I'm going to go ahead and look at your scalp here. I'm going to have you tip your head down. I'm going to just kind of feel in your scalp here. So his hair is dark brown. It is thick in nature. It is evenly distributed with no signs of hair loss. There's no signs of tinea capitis or any other scalp abnormality. His scalp is nice and healthy. It's not dry. We're going to go ahead and go down to your facial bones. I'm going to palpate. You're going to just tell me if any place it hurts or is tender while I'm palpating on him, okay? So coming down, nothing there. Maxillary and mandibular. We're going to go to your scalp, so frontal, nothing. Anything temporal? Parietal and occipital, anything?
Nope.
Okay, so there were no bony masses that I could feel, no feelings of bogginess or anything that would have me concerned that you have a facial fracture or a skull fracture. I'm going to go ahead and I'm going to palpate your temporomandibular joint here. So you're going to go ahead and open your mouth. So there's some mild clicking with palpating this joint. Is that pretty typical for you to have some clicking there?
Yes.
So I would go ahead and I document in his chart that that's a normal finding for him, just to make sure that we have that listed there. So now we're going to test the strength of your neck and your shoulders. So you are going to go ahead and turn your head against resistance for me. So you're going to go turn into my palm just to check your strength. So turn. Okay. Turn. Okay. Up. Okay. Down. Okay. Now you're going to shrug your shoulders like I don't know. Okay, so with resistance, his shoulder and neck strength was noted to be 5+. And with his ability to shrug his shoulders up, cranial nerve 11 is intact. I'm going to have you look towards the window over there and then back over here. So there's no signs of jugular vein distension that I can see just looking at his neck. I'm going to go ahead and palpate your carotid pulses here. So just keep in mind, if you're ever feeling for your own carotid pulses, you don't want to include both at the same time, okay? You can feel for one or the other, but never both. Okay. Okay. Carotid pulses are 2 plus bilaterally. They feel equal. We're going to go ahead. I'm going to listen over your carotid pulses now. I'm just going to listen for any abnormal sounds or anything concerning. Okay, and I'm going to listen in the middle. I want you to hold your breath here. Okay, so there are no bruits noted upon auscultation. That's just an abnormal sound that we might hear over your carotid. I am going to go ahead and palpate on your neck here. So I'm going to have you look up towards the ceiling. We're going to go with your trachea first. So it is midline. There are no masses, lumps, bumps, or bruises that I can feel there. I'm going to feel for your thyroid, so I'll have you look up towards the ceiling. I'm going to have you swallow. Okay. Any tenderness when I'm palpating in there?
Nope.
Okay, his thyroid is palpable. There's no nodules or masses that I can feel around his thyroid. So going with that, we're going to move on to your eyes now. So just looking at the outside of your eyes, your eyelashes and eyebrows are well distributed. Again, there's no areas that appear that you're missing any hair or anything like that. Looking at your lacrimal ducts in the corner, there's no irritation, no drainage. Your eyelids don't appear puffy or swollen in any way. With the folds to your eyelids, I don't see any rashing or anything concerning. Looking at the sclera of your eyes, which is the white part of your eyes, I don't see any yellowing or any concerning discoloration. Your conjunctiva do not appear irritated. There's no drainage or exudate, like anything filmy over the top of it. Your cornea, cornea, iris, and pupils all appear intact. There's no concerns for foreign bodies. And then just looking under your lower lid, I don't see any pallor there to your eyes, so that's a good thing. We're gonna do a visual acuity test, so it's just a eye test like you might have had at the doctor. Do you wear any corrective lenses?
Nope.
Okay, so you're gonna look with both eyes open here. You're gonna read the furthest line down that you can.
LTFPH.
Okay, now with one hand, you're gonna cover your left eye. You're gonna do the same thing that you did before. Furthest line down you can.
LTFPH.
Okay, now same thing, furthest line down that you can.
LTFPH.
Perfect. Okay, so he is OD 2020, OS 2020, OU 2020. After doing your visual acuity test, we're going to do a light reflex. So I'm just going to have you look in the center of my nose here. I'm just going to check and see kind of how this light appears on your pupils. So look right at the center of my nose. Okay, there is no exo or esotropia, so that would be the turning inward or outwards of your eyes. So your pupils do appear to be midline within your eyes, so that's good. I'm going to have you look right at the center of my nose here. We're just going to check your pupils' response to light. So, perfect. Perfect. So your pupils are equal, they're round, they're reactive to light, and they're accommodating, so that's a good thing. Next, we are going to do a test with a different scope. First, I'm going to check some visual fields. So you are going to look directly at my nose. We're both going to cover, if I cover this eye, you're going to cover that eye. You're going to let me know when you see a finger in your periphery, okay? Okay.
Yup.
Okay.
Yup. Yup.
Okay, we're going to switch.
Yup.
Okay.
Yup. Yes.
Okay, perfect. So by doing confrontation there, we were able to see that cranial nerve 2 is intact, so that's a good thing. You are going to look right at my nose. You're going to follow your eye, or excuse me, follow my finger with just your eyes. You're not going to move your head at all, okay? Okay, going through the 6 cardinal positions, there were no extraocular movements there, so cranial nerves 3, 4, and 6 are intact by you being able to do that. We're going to do an ophthalmoscope assessment now, so I'm just going to check the appearance of some of the internal structures of the eye. So you're going to look straight forward here. There's going to be a light in your eye, and I'm going to have to get really close to you, so I'm sorry about that. Okay, red reflex is present. I can see his macula, disc, and vessels on his left side. I'll give you a break here, let you blink a little bit. Okay, we're going to go on the other side here. Red reflex is present again. And then on the same side, we can see his macula, his vessels, his disc. His ratio appears to be normal on both sides, so that's good. We'll let you rest and kind of blink your eyes a little bit there. We're going to go ahead and move on to your ears. So I'm just going to check alignment and kind of feel a little bit on the outside. So just looking, your ears appear symmetrical. There's no drooping. There's no open sores that I can see to the external areas of your ear. I'm going to go ahead and feel on your, so there's no signs of like cauliflower ear. There's nothing palpable like a mass or anything like that. Going to feel your mastoid bone back here. There's no bogginess, negative battle signs on that side. No bogginess over here, negative battle sign over there, which is just a test we do to make sure that there's no blood behind your eardrum. I'm going to go ahead and I'm going to look in both of your ears now with the scope, just to make sure that there's no signs of an infection. We're going to start over here on the right side. You kind of tug on your ear, sorry. So there's a moderate amount of cerumen over here on the right side. His tympanic membrane is gray and pearly colored. There's no signs of bulging. There's no exudate to the ear canal. His cone of light can be seen at 5 o'clock over on that side, so that would be a normal finding. And then over here on the left, again, moderate amount of cerumen to his ear canal. A little more difficult to visualize the tympanic membrane on this side, but from what I can see of it, it appears pearly gray in color. Again, there's no signs of exudate or drainage down into that ear canal. There's no drainage or exudate on either side for the external ear either. Now I'm going to come behind you. I'm going to whisper a series of numbers and letters. I want you to repeat back what you hear as I'm behind you, okay? Okay. C7B.
C7B.
Okay. D8C.
D8C.
Perfect. Okay. And by you passing that whisper test, we can prove that cranial nerve 8 is intact. So knocked another one off the list there. We're going to move on to your nose. We're going to just check the patency first of your nostrils. Check for any foreign bodies. You're going to just look up towards the ceiling for me. So besides some nose hair, there's nothing occluding the patency of your nose there. No foreign bodies that I can see. I am going to ask you, you're going to go ahead and close your eyes. You're going to smell this and tell me what scent it is.
Strawberry country.
It is. So cranial nerve 1 is intact based on his ability to smell the candle. I am going to go ahead and look in your nose here with the speculum. I'm going to have you look up towards the ceiling there. So his nose is slightly red, a little irritated. There's some coarse nasal hairs in there. His turbinates do appear red and slightly irritated. His septum is not deviated. His mucous member, or his mucosa to his nose, is intact. There's no cracking or bleeding that I can see in there. Same thing to the other side, sorry. No foreign objects. Same thing, he just looks a little inflamed. His turbinates do. There's no cracking, no bleeding, nothing that I can see on first glance looking in his nose there. I'm going to go ahead and clean my hands between touching his implement, or his equipment there. Would want to make sure that if we're using a disposable, that we would throw away the cover at that point. For our purposes, we'll just get a new one. We are going to move on to the mouth and pharynx area. So just looking at the outside edge, the corners of his lips don't appear dry or cracked. There's no redness I can see. Go ahead, I'm going to have you open your mouth. I'm just going to look around at your teeth and your tongue. So the patient appears to have all of his adult teeth minus his wisdom teeth in the back. His tongue appears to be moist. There's no geographic tongue or any abnormalities. I'm going to have you look up towards the ceiling and just check his palates. There's no signs of petechiae or any other rashing there. No signs of any open sores that I can see in his mouth, like canker sores, anything like that. I'm going to have you open your mouth and say ah, like they always have you do. So tonsils are noted to be 1+ on both sides. Uvula's midline, there's no uvulitis. There's no exudate or irritation noted to the back of your throat, which would be concerning, obviously, for strep throat or something like that. I am going to go ahead and I put on a glove at this point. I would go ahead and palpate the inside of your mouth, feel for any areas that are abscessed or that appear to have a mass or sore in case I missed anything upon inspection. So after doing that, I would throw my glove away, refoam my hands, come back, go ahead and glove again. We're going to go in, we'll check a gag reflex, so you'll say ah. I would stick the tongue depressor back. Gag, you are going to repeat after me. So you're going to say light, bright, dynamite.
Light, bright, dynamite.
So by being able to say that, cranial nerves 4, 5, and 7 are intact. We're going to have you do just one last test here with your face for your mouth. So you're going to clench your teeth, show your teeth, perfect. You're going to puff your cheeks out. Okay, now you're going to close your eyes really, really tight. Don't let me open them. Perfect. Okay, now raise your eyebrows up like you're really, really shocked. Okay, so by being able to do that, we have determined that cranial nerves 5 and 7 are intact. The last thing we are going to do after doing an ear, nose, and throat exam is a lymph node exam. So you're going to just let me know if any area that I'm palpating here is painful for you, okay?
Okay.
So we're going to go preauricular, postauricular, occipital, submandibular, submental, cervical, deep cervical, and supraclavicular. Was there any tenderness with any of that palpation?
No.
So there were no palpable masses, nothing that would have me concerned. If you had a painless enlarged lymph node, we would become concerned, but nothing was palpable there. We're going to go ahead and stop with your exam today. Do you have any questions or any concerns about anything that we found?
No, ma'am.
All right, that's it. Thank you.